Hi, everyone. I'm Teri.
And I'm Ella. Welcome to the Chasing Red Flags podcast. Let's get real. Here, no topic is off limits.
And real beats perfect every time.
Welcome to the conversation.
Welcome to where you belong.
You're part of the family now, so let's get real together. Hi, Mama.
Hi, sweetheart. I have a little bit of a sore throat and my voice is very raspy, so I'm not going to say much until we start in about a second, but I love you and you look beautiful and it's good to see you.
Thank you. I'm sorry you don't feel good.
Okay.
I love you.
I have just a little something going on in my throat, but I love you too. So I'm just going to get into it if that's okay.
Let's do it.
All right. So today we're thrilled to welcome a guest who's making waves in the mental health world, Dr. Jessi Gold. We both read her book, How Do You Feel? And we can't wait to ask her questions about achievement culture, seeking help, breaking mental health stigmas, and navigating our feelings in this highly competitive world. It's going to be a good one.
It is going to be a very good one. I am excited. But before we get into it and go all deep, we just want to say thank you all so much for being here. We truly appreciate your support, whether you are tuning in for the first time or you are a day one listener. Please subscribe to the Chasing Red Flags podcast on Spotify, Apple Podcasts, or wherever you listen to yours. And please don't forget to subscribe to the YouTube channel to watch all of the episodes. All right, let's do it.
It is my pleasure today to introduce today's guest. She is Chief Wellness Officer for the University of Tennessee System, overseeing mental wellness across 5 campuses, which is 59,000 students, an Associate Professor of Psychiatry, and a passionate advocate for college students, healthcare workers, and even the entertainment industry. Her first ever book is called How Do You Feel? I have it right here. And in it, she explores the search for humanity in medicine and within herself.
And for those of you tuning in, college students, young adults, medical professionals, and parents, I know how real the pressure can feel to be happy and perfect and have this appearance, even when you are struggling behind the surface and beneath yourself. And so, I will say that was me, and it almost broke me. And so that is why we are so excited to have Dr. Gold joining us today to dive into these deep topics. So, Dr. Gold, Jessi, thank you so much for being here and welcome to the show.
Thanks for having me.
It's amazing to have you here. I'm so excited. And we know how busy you are. So really, Thank you so much. And before we get into it, I have to admit, this is like the first thing I noticed. I love that you are a Swiftie. I am a Swiftie. We are very big fans and we huge. That's all I listen to. And so we're big fans of how you reference Taylor Swift throughout your book. Can I ask what made you want to incorporate her?
Yeah, I think I was also going through a time where a lot of the lyrics were useful. Part of why I think her stardom exploded again over the pandemic, despite me having been what I would consider an elder Swiftie, and I saw her open for Keith Urban, so I've been around.
Oh, wow.
So I think that exploded because she did these deep cut albums over the pandemic when everyone was like, I need deep cut albums and lyrics. And I think since I was thinking that was sort of the soundtrack of that time period for me, I think it was in my head in that way. And then I listened to the music and I've gone to the concert, every concert since she opened for Keith Urban. I've seen every tour. And so, for me, it's now it's kind of okay and trendy to cite Taylor Swift in a book.
Yeah.
I think
you did that before. It was cool.
Well, I read your book twice, partly because I read quickly.
Oh, wow, that's a lot.
I know,
Wait,
but
she rereads
I
things
read
all the
quickly
time.
and I miss things. So I wanted to keep revisiting moments. And it's an easy read, but it covers a lot. And it's not just the healthcare system and caring for patients, but it's also your personal stories and experiences, which was incredible to read, and about college students. So it feels like there's truly something in it for all of us. Was that your goal, to connect with a wide range of readers?
Yeah, I think if I wanted to write a book just for healthcare workers, I could have written an academic paper, an academic book. I write a little bit more for the general audience anyway, and that's been my bent. But, it's complicated because some people might argue that using just, except for a pre-med, healthcare worker adjacent patients makes it much more niche that way. And that the audience is solely intended to be healthcare workers. But I sort of see healthcare as this weird specific village that just has complicated caregiving responsibilities. It doesn't mean that nobody has the same things that led you there. I think every field struggles with similar themes. It's just that the field I happen to understand the best personally and professionally, especially during that time period.
Right.
And so it just made sense to model it that way. But
Yeah.
I think that we all struggle with burnout, perfectionism, overwork, like mental
Every
health
topic in here.
crises, like whatever you want to say, right?
Yeah.
Like
Everything. Yep.
And so I hope that people don't go like, oh, she just used healthcare examples. It's not for healthcare,
It's
like
not
anybody
just
outside of
healthcare
healthcare.
examples.
No, it isn't.
It's really
And I was gonna
relatable.
say, well, I think our listeners are going to resonate with your stories, like beyond the healthcare workers. Like, I think every listener that's listening right now, like, can you kind of start by like taking us back to like young Jessie? Because I know that both of your parents worked in healthcare, so you did talk about being surrounded by the expectation that like smart people become doctors, and like
Yeah.
how that influenced you as a child.
Yeah, it's so funny, like you do this podcast with the family bent. I think I didn't write a book to write a tell-all to diss my family.
Of course.
It was very important to me that what I
Yeah.
was writing was relevant to the conversation. So
Absolutely.
the stories that are told, I checked with my parents and made
Mhm.
sure they felt okay that it was in there. But it was like, how do I tell the story without it making it seem like it was their fault? Because it's really not their fault.
Right.
Like it was the air, like it was just what I
you
saw
grew up
and
in.
knew and
Right.
understood. Like I don't even think they ever said anything to me about it. Like yes, I mentioned they do like a bit of positive reinforcement around good grades and like we got money or like presents or whatever, and that
Yeah.
was just until
We
I got
did too.
boring, and then I got good grades all the time and I didn't get presents anymore.
Yeah.
But then
Right.
I was so into it by then and sort of had this like, I don't know, definition of myself that included being smart and that it was really important to me. And then I really struggled with any kind of mistake or imperfection, like especially academically. I mean, I think if I would like think I was gonna get a B, I'd be like, I need a tutor. And my parents were like, I
That
don't know
was
what
me.
I don't
That
know what
was
happened
Ella.
to you, but we'll get you. Like
Yep,
we're
right.
not gonna say no because like I don't want you to feel like we're not supporting you, but also
Yes.
like you can get a B
And
or
it's okay.
something,
Right.
know? And I always knew it was weird. Like my head was like, it is weird that I want a tutor. Like I'm not going to tell my friends I have a
Yeah.
tutor, and not because I'm embarrassed that I have a tutor, but because I'm embarrassed I have a tutor because I'm getting a B.
B.
Yeah.
Yeah.
Like and I think like I knew in my head it was like a little obsessive and weird and like that I was being too hard on myself, but I couldn't stop.
Yeah.
And it didn't, I got a lot of like I would keep doing well. So
Yeah.
it was like, oh, and then you did well again. And so then I was like, ooh, this is what I do. I do well. And I'm the youngest of four. I mention in the book, like, so there's 10 years between me and my oldest brother, same parents. My parents just spread us out. And when that means when I was like 8, my older brother was already in college and he went to Yale. Like my sister is like another 3 years below that. And when she went to college, she went to Columbia.
Oh wow.
And so I was like 11,
Lots of
and I had 2
achievement.
siblings in Ivy League schools. Like you just, and if like people keep telling you you're smarter than those two, it's very confusing because you're
Absolutely.
like, but like if I'm smarter, then like there is no, like I don't have a choice. Like I
Yeah,
have to
to
go
do
to a
that.
school like this. Like there's no way I can't because like then it's not like living up to my potential. And again, like I don't blame my parents. I think
Of
it's
course
really
not.
important that my parents like prioritized achievement in some capacity because it made us work and want to work and do fields where we work hard, and all of us do. And I think that was really important. But I do think that like sort of just absorbing it and the feedback I got and what I understood like really led me on this like I didn't really like to fail, and then
Yeah.
like I wasn't good at tests. I wasn't good at standardized tests, and like
I see so
that
much of
was
Ella.
like really hard.
So
Well,
much of
I
Ella
was
is
literally
in your
about to
story.
say, like, I really do recognize a lot of myself in you, especially while reading this book. I always, first of all, I was horrible at standardized testing. Like my MCAS to my ACT to like even tests now in college, like it's just not my thing. It's my anxiety. I don't know what I do, but it's something that's in my head. And I always, and mom, like
But
I
yet
love you,
she
but
gets
like you don't
straight
care.
A's. I mean, she
like
works
now,
really hard.
Yes, but like, no. Yes, but like if I got a B or I got a B minus,
She wanted
you'd
a
be like,
tutor.
"Oh, it's okay. C's get degrees. Like I wanted a tutor, and like I just think, like I punished myself when I didn't do well, even when mom and my dad like they didn't care. It was just
Yeah.
something within myself. So I kind of resonate with that a lot.
Right.
Yeah, I could do school tests fine. Like it was like you could study, they asked you test information that was based on what you studied, and I never like had the same reaction to school tests. And not even AP exams, because AP exams felt like they ask you the content that you learn in the class.
Right.
And I just had a lot of problems with these tests that like had so much say but were intended to trick you.
Yep.
Because they weren't actually based on
What
like
you've learned.
knowledge
What you
or
were learning.
anything. And I couldn't handle like even like the MCAT, right? Like in theory, it should be based on like what I learned in chemistry, what I learned in physics, but it wasn't really, right? And I just got like myself really sick about it. I mean, I
Yeah.
threw up in the ACT and canceled my scores. And
You sound so much like Ella.
my parents would always just
I
my
know.
parents would be like, it's a test.
Yeah,
Like
it's not
you
the
know,
end
I
of
think
the
that they
world.
would want me to do well because again, my siblings all went to these schools and that is like what they also would have wanted for me, right? But I think like the fact that I called my mom, like I was in boarding school and I like went to the ACT because I was already not into my SAT scores and
Yep, that was me.
like I was like, oh, I can do this. It has science and whatever. And I like, you know, they said 10 minutes left or whatever. I got like super panicky. I finished it, went to the bathroom, threw up, and then like I was like, okay, I can leave. And then I called them and I'm like, how does this work? Do I get an incomplete or what? And they were like, no, you can cancel your scores. You just pay. And I was like, cool, sounds great.
Yeah.
And I called my mom and I was like, I just canceled my scores. And she was like,
I'm like, what are you doing?
she was like, why didn't you go back? Like, I don't understand why you didn't go back in there. Like, but couldn't you just like walk around, take a break and go back in? And I was like,
Yep.
oh, I can't go back in there. Like there's just no way.
not.
I was like, I don't even think I got any of the first section right, which is probably not true.
Yeah.
But, you know, I was like, I can't do it. And she was just kind of like, oh, okay. You know, and my parents, I didn't go to therapy until college. And like, you know, when I look back at that stuff, I'm like, I mean,
Right.
I wish someone would have been like, you know, you can work on that.
Right.
Yeah,
You know?
like it's something you can improve on.
We're a
but
big fan of therapy in our house.
talking about like the medicine side of things, I know your book really pulls back the curtain on topics like the overachieving perfectionism and the stigma around taking medication in general. And I feel like that's an issue that so many people deal with, me included. For the longest time, I really did think, oh, I don't need to be taking medicine to help me. Like I should be able to do it on my own. But how do you think that sharing like your story and what you've learned like helps break down these stigmas? And what are you kind of like hoping it has on the readers beyond the medical field?
Yeah, I mean, I didn't realize I stigmatized myself for being on meds for the longest time,
Yeah.
right? Like when someone told me to go on meds, I didn't think really anything of it. I just
Yeah.
was like, okay, like I'll take a medicine. Like it didn't, and maybe it's because I grew up with Dr. Dad or something. Like it just wasn't like, oh my gosh, like no, I was like, okay, like whatever. And then I
Fine.
never really thought about it again.
Yeah.
And
That's
then I was
great.
just like, I'm still on it. I've been on
I
it,
know.
right? But I think it was like, and I don't know why, like I don't have a good reason behind that. And I wasn't like telling everyone I took it or anything.
Yeah.
It just
Right.
was like, it was
But
a
it's
thing.
great
And I
that it
said,
wasn't
okay,
a big
fine, I'll
deal.
do it. Yeah, but then it obviously was in some capacity because like
Right.
the story I tell in the book is like there was a time during COVID when like a bunch of people were sharing online about like being healthcare workers who like and how they take care of their mental health.
Yeah.
And I only shared that I went to therapy and I started looking and I was like, what's with all these people talking about meds? Like I've been on meds for like 10
Forever.
years.
Yeah.
Like I haven't even adjusted it. I'm so boring. Like
Yeah.
like why did I not even say that? And I was like, did I just think it wasn't relevant or like is there
Yeah.
something else there? And like I brought that with me to therapy and you know really figured out that like I had my own sort of like deep down in there, no matter what I say to patients, even though I really believe what I'm telling patients, I'm not blowing smoke, like belief that if I was on meds or someone knew I was on meds, they'd think that like I wasn't cut out to do what I was doing,
Yep.
that like my emotions like would take over at any moment and I'd not be able to handle it. And also like that patients might judge me for it, right? Like I just didn't want that. And like I think I knew on some level from an advocacy perspective that like meds have not even close to reach the level of therapy. But I think that I never really like was like, oh, I bet you I feel that way. And so
Yeah.
when I realized I felt that way, I was like, there's no way
Nobody
there's literally
else
no
feels
one
that
who
way.
doesn't feel this
Yeah,
way. Like
exactly.
because like I've anybody, you know, and so I think sharing it for me isn't like I've never shared it as like a yay, look at me, I'm on meds.
course.
Like I've shared it more like here's the thing that I figured out about me and how I view meds. And if I view them like this, like, I get why you do.
You do too.
Right.
And like,
Yeah.
that's always been like what I took from it, not like, here's my story. My story's really interesting. Cause I don't really actually think it, like that part of it about
But that's
it really
impactful
is.
though
Like
for us
Yeah.
as readers, to be
And
honest.
that's why I related to you so much, because I felt that way too. So it was nice to hear that like even somebody like you feels that way.
It feels good to hear that. And on our podcast, we talk a lot about how we speak to ourselves and building self-esteem and reminding ourselves that we are enough, which you definitely touch on in the book. But in today's world, where there's so many people that feel, the pressure to avoid failure and to hide their emotions or feel like they can't mess up, how do you think we can start, changing that mindset more? I think that's part of what you are doing in the book that we felt very, connected to.
I mean, I think vulnerability doesn't always mean you have to do what I do. Like, I think some
Yep.
people like have to do what I do and say like, hey, I'm Jessie, I'm a psychiatrist, I take meds, I see a therapist. But I think most people just need to like say some of the quiet stuff out loud and like stop pretending that this is also easy for everybody. Like, it's just boring to pretend that that's true. And I think that like the expectation that we all can isn't like helpful. And so do I think medical culture can change tomorrow? No. Do I think we're somehow going to not have really bad hours and like really hate our jobs? No. But do I think it's worth like actually saying like, oh, turns out the hours suck and this job is kind of miserable, but you can support each other through it, like, will actually help people? Yeah. Because people still will want to be doctors and nurses. Like, I mean, there might be a time where they don't, and like you could maybe answer that better, Ella, but I do think that there's like less of a draw of the prestige of it and like more of an awareness that like there is no work-life balance. And I tell that to my people and that I talk to all the time about it. But I do think that like we can crack things by just being like, that was hard, or work-life balance doesn't really make sense in here. Or like, isn't it weird they tell us not to pee? Or like just things that I don't understand why we don't say. They're just super boring. And they actually would like make people feel a lot more seen and understood and less alone, and like would start to crack the surface. And if like a supervisor said it, you'd then feel more comfortable going to them about something else and all that stuff. And so for me, like, I think that like that degree of vulnerability can do a lot to shift the environment that people are learning and studying and getting supported in.
Absolutely.
I think it starts in college. There's a reason I picked a pre-med to include, because I think for so many reasons, like people have this belief that like you get plopped into med school and med school ruins you. But I've seen pre-meds as patients for a very long time. I was one. Like, it is not a good time either. And so I think, pretending that's not true is not helping anybody, and understanding sort of the lifespan of this stuff and where it starts and how you enter and what medical culture then does with what you came with as like a slate, like, makes sense to me.
And just being educated on what it is. Yep.
And I think like, in some ways you might still have to change a little to fit a culture that's not moving very fast, but like understanding why you're doing it and that you're doing it to survive and that you're not doing it to change yourself forever, I think makes a difference. I think it also, like, I approach work now like burning out is like a logical conclusion as opposed to a failure. Like, I think that
I like that.
for some reason in like our jobs, we have this belief that like if we do more, if we just like put our head down more, if we just dissociate from emotion more, like we somehow won't be affected by it. And I think that's what's modeled, that's what's like, given praise, that's what gets good feedback, and
That's
it
the
doesn't make
problem.
any sense. Like that, like it just doesn't make sense. And so I've approached it a lot more now, which helps me to be like, and to people I talk to and support too, is like, why wouldn't you burn out? Like, what do you, like, it doesn't make any sense that you wouldn't. Like, why? And if you approach it like that, you'll build in like ways to help yourself, you'll build in support, you'll build in time, but at the same point you won't, like, you said, be kind, like you won't like beat yourself up about it, because like you didn't fail to burn out, you actually just did your job well, and doing your job well
is
means
making
that
you feel
you
this way.
feel like that sometimes.
Right.
Well, I love you mentioned the phrase a lot, which I feel like connects with this fine before. And I will say, like, I've used that a lot, especially when I wasn't actually fine. And so, like, I know from, like, your perspective, you describe fine as, like, feelings I'm not expressing. And I feel like I hadn't heard that before. And so it truly does, like, make so much sense. And, like, when you can tell that somebody is pushing down their feelings and just, like, pretending that they're fine, what are like ways that like what are things you say to help them open up?
Yeah. I mean, so you can only do so much. So I'll just say that there's a lot of like being a support, being a good supervisor, being a good parent. That also means that you come back a couple times, or you have to have boundaries and realize it might affect you, that you can't fix someone when you think that they could use the support, because being a support of someone who's struggling is really hard. It just is. And I think we like beat ourselves up for not being able to fix it or get them to listen right away. And like sometimes they can't or won't, right? Sometimes they don't trust you yet. Sometimes they're not there yet. But, you know, I think for me, like, it's not just like, how are you? Okay, fine, like, let's walk away, and like, whatever. It's like sitting and listening. It's like actually engaging in the conversation. It's being vulnerable so that someone will be vulnerable back. And again, I don't mean like, hi, I'm Jessie, I take meds. I mean like, work's been really—
Is that how
like,
you introduce
this time
yourself?
of year is really hard in our job. Sometimes. Like, you know, I think about it more like, this time of year is really hard in our job. What's it been like for you?
Yeah.
Or like, I started
that.
meeting today being like, can everybody tell me something good that happened? Because this is a really bad time of year. You know? And I think like even saying that made them go, oh, she says it's a bad time of the year. Like, I might feel bad right now. And I think like that can make a difference to people feeling like safe to actually talk to you. Because like, if you ever have a friend and they're just asking you a ton about you and they never give anything, you're like, I don't trust that person. Like,
100%.
what's with these probes? The only person allowed to do that is a therapist, and there's complicated
There's
complicated reasons why that's the case, right? And I don't even completely believe that that should be the case, and that's a whole nother conversation. But
for us, it feels like the standard for being fine is really set low right now. And unless we're wrong, that's kind of how we feel, is that it's set so low that sometimes, you know, if a college student thinks fine is that they didn't get in trouble or they have good grades, or a medical professional thinks fine is, let's say, that they didn't kill someone or they didn't hurt someone, right? If they avoided a major mistake. But in both cases, there's internal other negative things going on. How can we shift away from that narrow version of fine and address the deeper struggles? Because that's kind of where we feel like we're
and also
at.
like, would you want that to be the barrier? Like,
No.
every time my patients come in and say stuff like that, I'm like, I feel like if someone heard you say it out loud that was like your patient, they'd be like, oh gosh,
Right.
you know, like
Exactly,
that's
I
just
agree.
bad, right? Like, I don't know. I mean, I think for me, it's like recognizing that there's more to life than school and work, and that we measure things by school and work, but there's so much else going on. And like, we need to be aware of like how, as much as we have identity that's defined by work, I'm single, have a dog, and work all the time. So like, I'm not one to talk, but I have to be like, you know, you're saying no to the stuff you like you're only going on work trips. That's not vacation.
Right.
You're not, you know, like, I have to remind myself the same thing, that like this stuff bleeds in. And sometimes with college students, I'll be like, how are you? And they're like, my grades are good. And you're like, well, what's the rest of your life look like? And they're like, I haven't left my room. I drink all the time. I have no friends. And you're like, okay. You know, like you know, there are other measures of like, are you doing okay? And I think that we just like neglect them in the concept of sort of like what we measure success by. And I think a lot of us can do the things of our job and the things of our school like almost on rote. Like, I think I was pretty bad in college before I got help, and I was like wearing sweatpants all the time, and like I skipped class a lot because I didn't think I had to go. And you know,
Oh, wait, you
and I
heard
think
it
like
here. Dr. Gold
if I didn't
skipped
get help,
class a lot. That's news. That is actually surprising to hear. So I just had to take a moment for that. And she's a doctor, everyone.
Yeah,
She
I
has
mean,
lots
you know,
of degrees and she skipped classes. So you're going to be just fine.
And she's skipped a few classes. It's not the end of
That's
the world.
an important thing.
you know, like
Yeah, the big lectures, the econ, like all of those.
like big science classes. It's like, I don't know, sometimes I can read the book, right? And you're not, and it's not great, you know, like I didn't miss the ones where you got graded for being there, but I wasn't showing up enthusiastically. And so, you know, I think it's just like, there's a lot more that I wish we would measure stuff by. And like, you know, I think I wish that I was okay with like questioning things along the way in college and not being so set on like this being the only thing. Maybe I would still end up where I am, but I think that when you question things early, people sort of like take that as like you're not cut out for it, or you feel like you're not cut out for it, and then you get more defensive and you kind of like hammer down instead of going like, I'm questioning because that's healthy, and like this is a long career path, and like I just want to make sure that this is actually what I want to do. And I think that I wish people, like my college student patients, the people I interact with in college, I'm always like questioning is like actually really important, because like if you don't, like, you're just like, what happens for people in medicine is they don't until they're like my age, and then they go like, oh wait, that was like 10 years and now what do I do? Like my training's not applicable to that much, like I'm here or whatever. Or they do it as a resident, you can't switch fields very quickly. There's just like when you finally stop and go like, wait a second, like and ask yourself why you're doing something or what about it is where you get your like passion or enjoyment, or who told you to do it and where that's coming from. Like, my therapist in college was like, go through all the fields and like tell me why you don't want to do them all. And
That's
I was just
actually
not
really
in the right
interesting
like
and good that she did that, because it kind of makes you categorize everything.
it is, but I wasn't ready.
It was too
Yeah,
late.
you have to be ready.
I think she was trying not to get me to quit
Got it.
and like stop coming to see her. And so she didn't push it. Like she wasn't like, the answer isn't just because you want to be a doctor.
Right.
Yeah.
The answer has to be like, what about that field is unappealing? And why do you want, and she pushed some of them, but I feel like, it was a very good question. When I look back on it, I'm like, I really wish I had taken that seriously. I might still
Yeah.
again end up where I am, but like I sort of was like, like this is such a dumb assignment.
Yeah, like, I
this
don't
is
wanna
the
do
dumbest
this.
assignment.
Yep.
I've always wanted to be a doctor. The answer to why I don't want to join the circus is because I'm going to be a doctor, right?
Yeah.
Like it wasn't like I didn't take it as seriously as I wish I did. And I try to tell students that I like work with that, because I do think like you might still end up that like what you want to do is medicine, or you might question it at one phase and the answer still you do, and then you question it later and
Yeah.
it's not. But like that's okay. But I think like we shouldn't see questioning as like bad. And
Right.
for some reason, like I remember even like going in college, like I was like, oh, I don't know if I want to do this. And like the pre-med advisor was quick to be like, well, you're an anthro major, like maybe you shouldn't, right? Like it wasn't
Oh,
like,
right.
oh, well, if you want to do this, you can do this. It was like, well, you already decided to like not major in science, so you're not cut out for this. Or like my
But you
parents
could
would be like,
still.
yeah, my parents would say, which I think was nice, but I just don't know that like they also knew what to do. Like those classes are really hard. Like, honey, like maybe you just
And that sounds
are stressed
discouraging.
out. Like maybe
Yep.
they're just stressing you
Right.
out. Yeah, and it was
don't mean it
right.
that
They
way,
don't,
but
right? Like
yes.
like it was
But
the
it comes
right
off that way.
like it was the right thing to say. Like I think like really it did come from that classes, and it did come from the people I was around, but like I hadn't really questioned it earlier in my life, so it also was fair to question
Right.
it. And I think that when you hear that, you go, oh, like is the classes. Like I can
Yeah.
do better in the classes. I took
Yep.
summer classes like all the time because
So
I
did-
didn't want to deal with the people. I
Yeah.
would do like I did chem in the summer. I did
too.
orgo, or I did orgo
I
in the
was
summer. I
taking
did physics
classes
in the
every
summer.
summer.
Mhm.
And like that was the only
That
way
was
I
me with like
survived.
finance, so makes sense.
So okay,
Yep.
so while we're talking about this, you do for parents' perspective, but you talk about the mental status exam, which I'd love to talk about a little more, which
Yes.
actually was a very important part of your book to me. It's more than just a typical physical exam. It's something that we as parents should be doing more, in my opinion. Can you explain what that is to our listeners and how that approach can help us, pick up the deeper internal aspects of well-being that get missed?
Yeah, like in mental health, instead of a physical exam, though, we can, as psychiatrists, like listen to your heart and lungs and
Right.
stuff if we think it makes sense, or we just meet you or whatever. We do like what's called the mental status exam, which includes things like appearance and speech and movements and like again sort of perception, so like hallucinations, things like that. But it really like is like, how are you appearing? What's your behavior? Is anything changed? Is anything like the way you're looking, the way you're acting, the way you're engaging? Are you feeling like there's something different there? You can notice subtle stuff that way. I think early warning signs of things like psychosis and depression, for sure. You can see if you're pretty adept at kind of catching some of that. But really, like, it just means like all of the things are evidence. Like, it's
Yeah.
not so much that you need to be like, oh my gosh, she said this thing in this way and that means this. But it's like, their speech was like a little more rapid, and like they are like jumping around a little bit more, and they're not able to sit still. Like, I wonder what that's
Right.
about.
Yeah.
And then, they say some things that don't make sense. Like, are they manic? Right? Like, there's just things that you start to put in evidence that kind of you can put in your pocket and pay attention to. I think parents, but siblings, friends, etc. Like behavioral change is the best place to notice stuff
Behavior
anyway.
is
like
language.
if you're a
It's a
person
language.
who responds,
Yes.
yeah. Yeah, like if you're a person who responds to text and you stop, like there's something about that. It
Going
might
on.
just mean you're
Yep.
overwhelmed and over it, but like there's something about it. And for me, one of my best friends like said that I become more productive when I'm more stressed out, and I didn't even like notice that was a thing. But it's a problem having psychiatrist best friends. But
Yeah.
like it's true. There are different ways that different ones of us sort of like like change things about us, and it might not to most people. To most people they'd be like, wow, Jessie's like so productive.
Yeah.
And to her she was like, hey, what's up? And I was
Yeah.
like, why?
Why?
And she's like, you wrote like 5 things this week, and like to me you just do that when you don't want to do anything else, and I'm just
That's a
worried
great
about you.
friend.
And I was like, I think I'm fine, like I think I'm
Yeah,
fine,
that is a good
but
friend.
like
Yep.
I think that there are things that when you know people well, like you notice things like that, and those are the
Yeah.
things that maybe they don't want to hear right away, but maybe they'll hear later, and maybe will save their life,
Yep.
because
Yeah.
some of those things can be subtle, and the things that are not subtle are the times when things are a lot worse, and subtle differences can at least get inquiries.
I just think like, especially being a student, and I'm not just asking for like a college student, but just anyone in general, like how can you tell the difference between like normal stress and just being stressed and like real anxiety and depression and like other significant mental health concerns? Because I know there is a big difference, but how can people tell?
I would say like so there's lots of like you can use symptoms obviously, but I think the main things to look at are the other parts of like how we look at diagnoses. So like, is it interfering with your day-to-day life? And I don't mean like, is it interfering with school alone? We went through that. There's other aspects of your life. Is whatever you're experiencing preventing you from doing things that you want to be doing?
Mm-hmm.
Is it making it so it's harder to do the things that you used to do or like to do or whatever? That's a big thing to pay attention to. Is it getting worse? So did you like sometimes feel like you have a little bit of a headache when you have tests, and now you like actually can't focus for the entire 3 hours leading up to it? Is it like you can't sleep, and now it used to be like an hour, and now it's like a whole night, right? Like
Yeah.
those are changes that are worth paying attention to. And like severity matters, right? So like if you're in a setting where you're just like sad sometimes. We're all sad sometimes. We're all stressed sometimes. We're all anxious sometimes. Those are feelings. Feelings are fine. Feelings that interfere with your day life, feelings that come with like you can't sleep, you can't eat, you can't function, you can't talk to people, you can't do the things you like to do.
Yeah.
Then those feelings are much more than the feelings that come with wanting to end your life, right? Like, I mean, some people live their life with that always. And so in those folks, it's like, and then it becomes worse, or there's something about it that changed or something, but not most of us don't. Like, that's not
Yeah.
how everybody is. And so, paying attention to change in the way that things are is important, which means that you need to know what your baseline
Right.
is.
Yes.
Right. So part of what I'm a big fan of is like actually knowing yourself enough to know that. So like, I'm not good at that, but I actually think burnout, depression, anxiety, all these things, like they have symptoms, but they look different in everybody. Like what anxiety means to you might be different than what anxiety means to someone
Somebody
else, even
else.
though there is a diagnostic criteria, right? Like there's similarities, but like really
Comes
what it
out in different
means, the
ways.
way that it presents, what you're doing in your behavior, whatever. Like for me, an early warning sign of burnout is like I hate my emails. And like
Yeah.
not just like sort of like I want to throw my computer across the room, hate my emails. And like I used to just kind of be like, sometimes I hate my emails, right? But now if I
No.
feel like that, I'm like, oh,
I'm
I need
burnt
a
out.
break.
The term burnout is becoming more well known, but it's almost becoming a buzzword that isn't always used correctly. Can you break down the true difference between stress and burnout for us? Because obviously, there's times when we all feel stressed.
So stress is like a regular response, right? Like when our whole body told us to run away from things that were going to eat us or prevent us from getting into threats and all that. Like stress is just like your body's response to a stimulus that made you feel like all threatened or worried or concerned. It usually is it gives you information. Like there's something wrong with that situation for me, or it's like telling you something. Like that's what it is. It's really physical. Like it's often like heartbeat, breathing, headache, stomach ache. Like it's really physical, and it's short-lived and it goes away. All of us experience it. There's not a person who is not stressed, but there are people who don't have anxiety as a result of stress, right? Like it's like the anxiety part where then it becomes more prevalent and it's interfering with your life is not how most people experience stress.
Yeah.
And then burnout really is like it's workplace associated. it's so like if your workplace is school, that counts. If you're a stay-at-home mom, that counts. But it's workplace associated, and it's like a mix of emotional exhaustion, so like just spent at the end of the day. So sometimes like if you're hopped up on stress for a really long time, you can be spent at the end of the day. But if it was like I had something stressful and it went away, like I had a test and it went away, like that's not the same. It would be like you're like that kind of the whole time, and then at the end of the day you're like, wow, I've got nothing left in my tank. Sometimes the second symptoms either is cynicism or depersonalization. Cynicism is like anger, feeling kind of pissed off about all things and people around you and the work. Depersonalization is like feeling disconnected or removed, so more like a numbness, but actually more like a disconnected, like not really caring than a numbness. And the last one's a reduced sense of personal accomplishment, so you're getting less done. So stress, often you get stuff done, right? Like if you're stressed, like you might be like, ugh, this test is going to be really hard, but it's going to make you do the test. Or there's an emergency, you're stressed, you're going to leave in the fire, right? Your brain's going to say, run, get out of there, right? Or there's a bear, you probably don't want to be around a bear, so you should leave, right? But like burnout will be like, I can't get as much done. I don't have capacity. Like there's not much. I got nothing. I tried. I can't. I'm going slower.
And there's just nothing there.
Yeah, like, or you're just inefficient. You're just like not getting it done. Like, and so you kind of go like, wow, this is taking a while. Or, someone mentions it, you make a mistake, you make an error, like, sure. But like a lot of times it's like you actually just don't feel like you're doing as much. You're kind of like, I used to be able to do like all of this stuff. And it's just like, why is this taking me so long to do this stupid spreadsheet? Why is this taking, and it's like, because you're just like, I don't want to do the spreadsheet.
Yeah, you just stirred. That makes sense.
Yeah.
So here's the problem I hear from students all the time, including Ella. Admitting you need help feels like failing. And students are worried that if they take a break or admit that they're struggling, it's going to hurt their grades or their test scores or cost them a spot on the team or even miss an internship. So what are the signs that a high-achieving child is struggling that a parent should be on the lookout for?
Yeah, I mean, I'll just say, first of all, that concept is the same as assuming you won't burn out. So, like, stepping away makes you better. It just does. Like, Simone Biles is a perfect example of this. So, like, I think for a lot of reasons, people, like, thank Simone Biles for the fact that she stepped down, but I'm more thankful for the fact that she came back. Because to me, like, that narrative is where you should see it, right? Like, yes, she said, I can't, but she also said, look, I can't, I took time, I came back and I did, right? And so like that is what you like would like people to do, where you say like sometimes like life throws you things and you can't handle them and you need a break, or you need to take time, you need to decrease your course load, or you need to go home or whatever, but like it doesn't ruin your life. Like the stepping away saves your life a lot of times. I love that. Right? And so
that's
like
the lesson.
Yeah. And that's how I feel about stuff. Like, yeah, maybe not everybody needs to do that, but I do think that like perceiving it as a failure isn't helpful. Like it's much better to recognize that sometimes you need it and it's okay. Sometimes you need the time, and then you'll come back and you'll figure out what you want and you'll be better able to do what you want. And like, if you're like just passively going to school, like you're going to end up in a career you don't like. It just has like repercussions. You just keep going, And so for me, like, what do parents know? I mean, again, it's like, if your relationship with your kid is that you talk all the time and you stop talking, like that's relevant, right? Yeah, like they might just want boundaries and they like are growing in their identity, but they should be able to tell you that. Like, hey, mom, I don't need to talk to you as much anymore. Like, I'm okay, and that's fair. That's different than I'm not doing this because you're going to notice something's wrong and I don't want to have that conversation. Yeah. I think, having conversations like, hey, mental health on college campuses is complicated. I don't get eyes on you all the time, and I'm going to ask you questions because I'm concerned. How would you like me to ask you those questions so that I'm not annoying the absolute whatever out of you, right? Like, is okay, right? Because like, if you just do it your way, they're going to be like, what? There she goes again, like asking me if I'm sleeping or like asking me if I'm drinking too much, right? But like, if you're like, hey, mom, like, ask me this thing and like we can go by that, or I promise I'll tell you this, and if I don't, like, then, like, there's at this point you're allowed to step in or whatever. Like having like good early conversations around that and being like transparent about that is so much easier than just like not. Because
agree.
even if you don't have like a super close relationship, like saying, I just saw a bunch of suicides on the news, I'm concerned about that because people seem to act like the kid is fine and then they're not.
And then they're not.
You matter to me, even if our relationship is complex. How do I support you and notice when you need help and step in to help you when you might not be able to help yourself?
Can you help our listeners understand how knowing yourself better has impacted your work and your relationships? We always tell people that you really need to know yourself better because it helps your relationship with others.
Yeah. Huge.
Yeah. I mean, there's times I've done therapy where I haven't, again, like used it as much as I could. But I think like understanding myself, like I'm better able to notice when something's changed. I think that's really important because otherwise you're 100 steps down the road and then coming back from it is a lot harder. Like
Yeah.
we don't all need time off of school and we don't all need time off of work, but sometimes we
You
do
do.
because we don't notice until we do, right? And so sometimes genetics and life or whatever still get you there, but not always, right? And so sometimes like paying attention lets you go, oh, wait, like I could go talk to someone. Oh, wait, I could do that coping skill I learned that I keep forgetting. Like whatever it is, like having an awareness of yourself and monitoring that is much easier. Like if you told someone to deep breathe when they're like a 10 out of 10, they'll punch you in the face. But if you told them,
100%.
if you told them at like a 2 or 3, it's actually helpful, right?
100%.
And so it's like understanding that different things have different times, but the reason you're so frustrated when people tell you stuff is because they're telling you at the wrong time,
At the
not
wrong
because it's
time.
not a good help or at all. So,
Yeah.
you know, being self-aware can help with that. I think knowing what works for you is really important. Like just because someone says mindfulness is like has evidence doesn't mean you have to do it if you hate it. I hate it. I've tried it 100 times. And I mean, I
I
keep
don't love
trying. I
it.
mean, but it doesn't mean that I'm like, you know, it's bad for everybody. There's tons of evidence. So like,
Yeah.
you know, try out like
People love
coping
it.
stuff.
It's different for every person.
Yep. Try it out like it's a hobby.
We journal. We love journaling.
Yeah. I love to journal.
Yeah. I think like all that stuff
Everyone
is like,
has different coping mechanisms.
yeah, and the one
Yeah.
that you like is the one that you'll do, right? So
Yeah.
not beating yourself up if you hate the one that, you know, if people listening are like journaling's the pits, like fine, find something else, right? But knowing like yourself will help with that too, knowing what you can do to feel better.
Yeah.
And I think that like knowing myself, like I can hear when I'm not being nice to myself and I can hear when I'm giving myself expectations that don't make sense. It doesn't mean that I don't stop, right? Like I am a constant work in progress and I'm never going to be someone who said, I wrote a book on burnout, I'm never going to burn out again. But like, I mean, I'm like burnt out right now, probably from all of this stuff. So like really
You've been doing a
being
lot.
able,
Yeah.
but being able to
You
say
have.
like,
Yeah.
but being able to say like that just happens sometimes and I just need to adjust and I have to like I'm planning it for it to come in the holidays and I'm okay with that and I said that up front and I'm okay with that and how do I like take care of myself in the context of this is like relevant, right? And so I think that being self-aware helps with that too because you're able to sort of go like that's me being mean to me or that's me being unfair to me or that's me setting expectations that are not okay for me and like how do I reframe that or how do I live more by that and like understanding your values and the things that matter to you also can recognize why certain things bother you and other things don't, like, you know, so I've often said like authenticity is like a core value for me. Friends that are inauthentic, work environments that are inauthentic really, really, really trigger me. And like, I can't make people be authentic that aren't authentic, right? Like that's
but you can
just
surround yourself with the right people.
But I also can say that person's that person. That's a work friend. You're fine.
You categorize people. I love that.
Yeah. And I think recognizing like, you're mad because that's not what you do. You're mad because that's not a value of yours. But that doesn't mean that you can change them. You can't control them. So how do you deal with you in the context of that? And understanding yourself helps you much more with that because people will always annoy you. Like people will always push buttons because they're never going to be exactly like you and you can't control them and you can't do like you can't tell them what to do. And so like, you know, in so many ways you will constantly be doing that.
Well, I will say on shows, I'm a big Grey's Anatomy girl. I love it. But like, especially on Grey's Anatomy and I assume in real life, like we see doctors going through personal crises like while they're treating patients and not necessarily taking any time for themselves. And I feel like it not only normalizes it, but it almost like celebrates it as like a badge of honor. And so like, why is it so hard for healthcare providers to prioritize their own well-being while caring for other people?
Because
I know that's kind of hard question.
Well, because it's just silly to think that you can be good at caring for other people if you don't care for yourself. And it's not like a practice what you preach thing. It's just like, how can you show up for someone else if you don't show up for yourself? I feel the same in caregiving settings, like in challenging sort of parent-child relationships, but also like you're caring for an adult who like a parent, grandparent, whatever, like all of that stuff. Like there's this like, oh, if I just keep going, if I just keep doing more hours, like it's selfish for me to step away. Like really, if you don't step away, you're harming that person.
It's not selfish. And what we've realized, and your book helped us realize, is that we need healthy, empathetic providers who aren't burning out. And to be honest, I never thought about it that way until I read your book, and it opened up my eyes to this. And since I read it, I've talked to doctors who are going private, and they said they have more control over the number of patients they see. You said a quote that resonated with me. Healing the healer affects us all. Can you talk about that for a minute and explain how therapy and self-care for medical professionals affect the care they give others and why that's so important?
Yeah, I mean, obviously there's like the they make errors and mistakes bit of it that makes like the most sense to most people who are listening. But I also think that I hear from so many people that like healthcare workers like shut off when they try to talk about feelings, or healthcare workers judge them for having mental health conditions. And honestly, like I think the core of that is we haven't dealt with our own stuff.
Yeah.
And like it's scary to sit with someone else's emotions when you don't even know you have them, right?
Mm-hmm.
Like, and so like so many people will call psych consults where you're like, that person's just mad at you, dude. Like, or like that person's just sad. Like you can't call psych for that, but it's like it's easier to call psych. And then what that does to you as a patient is they think I'm crazy because I'm crying. Like, why is that? And so, I think when you look at it, sure, errors are a thing. Sure, patient satisfaction's a thing. Sure, time in the hospital is a thing. Sure, like if your providers burn out, you don't have access to them and you would like access to them because we already have a shortage of providers, right? Like all of those things are true, but I also think it's like they can't sit and be there and listen to you if they haven't dealt with their own stuff. They're not going to be as responsive and aware of the things that are triggering them and bothering them. And they're going to be like either shut off or like overly responsive in bad ways to you, or even like the point of being able to say you don't know is like a whole growth opportunity that's not taught in school. And I think so many people are like, why didn't they just say that instead of sending me to psych and saying I have too many symptoms, right? So I think it's important to recognize that.
I agree. No, 100%.
Right. I cry in front of my kids. I get angry. I slam doors. I've lost friends. I've had too much red wine and gotten sick. I failed and made mistakes, but I own them. I don't have it all together, and I show my kids my feelings. And I tell them it's okay for them to have big feelings. I think it's important for us as parents to express our emotions and to also show them our failures, which doesn't happen in this world with perfectionists and cancel culture where people feel like they can't do anything wrong.
Well, and going off of that, I think it's amazing, Mom, that you do that, and I appreciate it because it shows me that I can express my emotions just as much as you. But like social media as well and high pressure environments, like social media especially, like the need to keep up appearances like are also connected, I think, in today's world, especially for us college students, because we're kind of in the middle of it right now. And I feel like it can have a very positive impact, but also a negative impact on our mental health. And so I'm wondering, as somebody who is going through it and on social media and seeing all this stuff, like what strategies would you suggest for managing like all of that in a healthier way, particularly with like comparison culture and like the fear that like saying or doing one specific thing wrong can change your entire life? Because I used to think I say one wrong thing, I post one wrong thing, like my life is ruined, I'm done.
Oh, that's sad. I'm sorry.
Yeah.
I think social's not going away.
Yeah, I don't think social media is going away either.
Yeah,
but...
and so I think that there's a mindset of experts that think that if they just take it away, you won't use it. And I'm not one of those people. You could talk to some of those people. They have popular books. People read them. They talk about them. That's the plan. But to my belief is if you take it away, they'll use it later, just like we do with booze. And like then we didn't teach you how to use it and make you realize it could affect you, and then you overdose with it. Like there's no such thing as really overdose overdosing on social. But if you have no exposure and then you have a lot of exposure, I don't know what that would look like either. And so I think there's like an ignorance in sort of like if we take it all away, they'll be fine. I also think there's an ignorance in social media is the entire problem. But I do think that there's a mindful way of using social that we don't do. So I just joked about mindfulness, but what I mean by that is when you scroll, when you're looking, does it make you mad? Does it make you angry? Does it make you sad? Are you grinding your teeth? Are you like really judging yourself? Are you like telling yourself that you're not good enough? Like what's going on when you're doing it? We just go la 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 la. I'm just scrolling.
Literally.
This is a funny video. This is a funny post, and it's like war, right? Like we're just like pretending it has no effect on us. It makes seriously no sense, right?
But
and
it does. I agree. I think social media is a very complicated thing, but I don't think it's going away. So it's more like, I agree, like maybe understanding how certain things are making you feel while you're watching them or looking at them, and maybe that will help.
I think paying attention to sleep also really big. So whenever I like, what is it like to not have your phone as your alarm clock? I went through that for a while. I got a real alarm clock.
I have a Hatch I use instead of my phone, and I set it every morning. So I don't know if that really helps, but I definitely do that.
Yeah. I mean, I think for me, it was like I was obsessing about certain things before bed and like reading certain things. And you can just be like, I need to know. Like, first of all, you're not a bad advocate or a bad person or whatever if you like turn it off. You're also not one if you don't comment on everything. That's a problem with social. You're also not one if you don't self-disclose your entire life history on social media or in life because it's your story. It's your time. You do whatever you want with it. Social makes all of that complicated. But I think that like paying attention to how it's affecting your sleep is like an easy place to start, which is like, are you staying up scrolling and you don't know why and you have a lot of reactions but you're not even paying attention to that and you wake up and you're tired and then you're tired again, right? Like just don't look at your phone before bed. Take it out of your routine for the last 30 minutes. Like use the Hatch, use a digital old school alarm clock, which is I got. It was like $5. Like you just put your phone outside your reach where you have to get up to get it. Like plug it on a plug far away, plug it right outside your room. If you're in a dorm, I get you can't do that, but like plug it
by your desk
like
or something.
Closer to somewhere where you have to get up and get it. Like it just it'll prevent you from doing it. You'll get real mad for a while, but it's a behavioral change that's worth it, even for the time period.
There's clearly a mental health crisis, and not just on college campuses and in the medical community, but also in other spaces. And there's such a need for open conversations about mental health. And your book covers a little bit of everything, and it's really important.
Well, I just want to know, like, especially, like, what are the core messages that you do hope readers are going to take away from it? And I mean, I know I took away a lot of things, but, like, when writing it, what did you want readers to really take away?
Like you're not alone and that a lot of people are experiencing these things. They just don't talk about them out loud. That feelings aren't something to beat yourself up about or to over pathologize. They're just things and we're allowed to have space and time for them. That you're allowed to ask yourself how you are in the context of job and life. That makes you ask a lot of other people how they're doing. It doesn't make you selfish or something. It's just life, and I think that we just don't do that well.
Yes, I agree.
And for me, like, those are the main things. I mean, I think for the healthcare workers, I'd like them to recognize that they're humans before machines.
Yes.
And as people that go to healthcare workers, I would say, thank one every once in a while. We don't hear it as much as we should. I'm a psychiatrist. No one thanks me. Like, I don't get a lot of thanks. It's just not a thing because it's just like a weird gig, especially inpatient. Nobody's like, yes, you hospitalized me.
You save lives, so it is important to say thank you.
I agree.
So thank you.
One more thing I have to say. From reading your book, I loved like the advice of keeping a thought record, and I just wanted to like talk about that really quick. I think it's such a great like tip. Can you tell like the listeners what that is really quick?
Yeah, I mean, so it's a cognitive behavioral therapy technique, but really the point of it is just to like actually recognize how your thoughts and behaviors and feelings are related, which is exactly what CBT is about. But it's like every time I see this person, I feel X, like what is that thought? Write it down. What was going on when it came out? Oh, how did you feel when that happened? What's a way that's more balanced about thinking about that? That's not just like everybody hates me. It's like, well, sometimes when I say stuff, people get mad, and that's okay, or sometimes when I say stuff, I can't control what other people do, whatever that is. Like, the balanced thought is like how you kind of fix it. It can help with a lot of like that internal kind of angry self-talk too that we have, like recognizing that and being like, I wouldn't talk to a friend like that. How would I talk to a friend? And reframing it can make you have a lot more self-compassion, and that can be really helpful. So it's just like awareness is the first step. Once you start paying attention, you'll recognize how often you do it. Doesn't mean you can fix it all the time. Like, I'm never naive to think that, but I think it does make you go, I did it again.
Makes you more aware.
I
agree.
There you go, doing it
you
again.
can like break those habits eventually if you are more aware.
Yep.
Ella went to CBT therapy, and I feel like now I'm like, you're doing it again. You're doing it again. You just hear it in yourself more.
Yeah.
Well, our listeners are walking away with so many insights. Thank you for being here. Thank you for your expertise. Thank you for reminding us that even doctors can find comfort in a Taylor Swift song. You're exactly the kind of doctor that I would want from a patient's perspective.
100%.
Can you tell our listeners where they can find you on socials and where they can buy your book?
Sure. I'm at Dr. Jessi Gold on most platforms. I mean, I have them. It doesn't mean I use them as often as I'd like. Jessie is spelled like Jessica without the CA because Jessica's my actual name. Everything is also on drjessigold.com if that's like an easier thing for you. But most places you can get books. If it's not like in your local store or your library or something, they should be able to order it because it's with a big publisher. You just have to ask. But, if you want cheaper books, there's a place that makes cheaper books that I won't hate you if you get the book from there because it's cheaper. So you do you.
I have so many more questions I could ask, a million, but like I do also want to say, like, especially from a college perspective and like somebody going through it, like I just like reading your book like felt so personal, and I really do think so many other people are gonna feel the same. And like I just connect, like I love hanging with my dog and Sadie and binge watching TV shows for my mental health, and like I know you relate like with your dog Winnie and like some good mindless TV sessions too. So just like thank you so much for being here and being so open and vulnerable and honest and helping me feel better about being able to do the same thing.
And for everyone listening, let's say thank you to our providers and our doctors. You heard it from Dr. Gold.
I know,
is important.
Truly. You don't get
and
it
if
enough.
You're not thinking about it, think about it now.
That was actually amazing. She's incredible. I will say I have so many more questions that we could ask her, so hopefully we can do another episode.
I know. She's incredible and brilliant, and I was trying to take it all in while she was talking. But her honesty and vulnerability about what she's been through and her stories. And I think there's so much more in her book for people to read, but it's a powerful reminder, to us all about the strength in being real and being open.
I agree. I love it. It was amazing.
Yeah.
Well, that is today's episode. That's all we have. And we will be back soon with another incredible guest. So in the meantime, keep being real, keep being you, and know that we've got your back. If you have any thoughts, questions, or just want to say hi, we would love to hear from you. Your support means everything to us. You can find us on Instagram and TikTok at Chasing Red Flags Official and on Facebook and YouTube at Chasing Red Flags. And if you want to share your story, ask a question, or pick up some Chasing Red Flags merch, go to chasingredflags.com. The Chasing Red Flags podcast is produced by Jay Del Turco. We are new in this space, so if you enjoyed what you're hearing, please subscribe, rate, and leave a review on Spotify or Apple Podcasts, or add a comment and like on our YouTube channel.